This is a presentation on cognitive behavioral therapy brought to you by virtualcbt.ca. Today we're going to discuss what is CBT, who can CBT help, what does a typical session look like, we'll provide some examples of CBT activities, and how you can access CBT in your region. What is CBT? CBT is a structured type of therapy that helps people understand and change their thoughts and behaviors. It focuses on the present rather than dwelling on the past. CBT focuses on current thoughts, feelings, and behaviors. It helps people recognize negative or distorted thinking patterns and learn the tools to challenge negative thoughts while promoting activities that improve mood and decrease worry or sadness. CBT uses a cycle to understand how our thoughts, emotions, behaviors, and physical reactions are all connected. An example could be with the situation. Let's say maybe somebody cancels plans, and the thoughts that that triggers could be, I'm not good enough, or people don't like me. The emotions could be sadness, worthlessness, or anxious, and behaviors could be avoiding people, canceling plans with others as a result of this. Physically, you might feel tired, have a lack of appetite, or racing heart. What kind of symptoms can CBT help? CBT has been proven to be effective in treating symptoms of trauma, stress, depression, sadness, phobias or extreme fear, as well as anxiety and worry, panic attacks, agoraphobia, or symptoms of obsessive compulsive disorder. Here's what a typical CBT session can look like. First, you and your therapist will start with a check in. You'll review how the past week went, discuss any significant events or stressors, and assess current mood and emotions. Next, you'll review your homework. Homework is a crucial part of cognitive behavior therapy. It's what helps it become so effective as you're learning how to integrate it into your daily routine. When you review homework, you'll discuss any assignments or exercises completed outside of therapy. You'll review your progress and address any challenges. At this stage, this is where the cognitive restructuring and or behavioral activation support can come in, where you identify negative or distorted thoughts related to the target behavior or thought, challenge these negative thoughts by questioning their accuracy and evidence, develop alternative, more positive and realistic thoughts, or discuss strategies for increasing positive activities and reducing avoidance behaviors, as well as set specific achievable goals for the week. The next piece being the education and introducing new skills. At this point, your therapist will go over new CBT skills that you can incorporate into your week. In some cases, we will introduce mindfulness and relaxation techniques as well. This is where we can practice mindfulness exercises such as deep breathing or meditation, learn relaxation techniques to manage stress and anxiety, and then from there, we move into the homework assignment. This is where we assign specific tasks or exercises to practice outside of therapy. This may include journaling, challenging negative thoughts, or practicing relaxation techniques. For summary and closure, we review the key points discussed during session, and we set goals for the upcoming week. At this point, we encourage open communication and any questions. In CBT, we often use thought records. A thought record is like a diary for your thoughts. It's a tool used in CBT to help you understand how your thoughts, feelings, and behaviors are connected. By tracking these, you can identify negative thought patterns and challenge them. Here's an example when we use the scenario from our CBT cycle. The situation being a friend cancels plans that you've been looking forward to. Your thoughts might be, I'm not good enough, people don't like me. Emotions could make you feel sad, worthlessness, anxious. The behaviors might be isolating, canceling other plans, not leaving the house. So then we come to our alternative thought. The alternative thought is how we develop a more adaptive thought, something that's a bit more useful or helpful and isn't as emotionally loaded. That could be maybe they were busy or maybe they've been stressed out lately. And typically we get to that alternative thought by discussing evidence. The evidence could be that this same friend has never canceled on you in the past, Or maybe they did tell you that they've been feeling very overwhelmed lately. So we use that information to determine the alternative thought. And then we try and use the alternative thought moving forward when similar events might happen. Another tool we use in CBT is exposures. Exposures are a type of therapy that help us face our fear in a safe way. It's like a training program for your brain. You start by facing small versions of your fears and work your way up to bigger ones. Over time, your brain learns that things you fear aren't as scary as you thought. It's a bit like building up a muscle. The more you practice, the stronger you become. This can involve having a conversation with a stranger, joining a group activity, maybe going in an elevator, maybe not excessively cleaning, not overly packing for a trip, facing situations that might make you feel a panic attack coming on, going to a busy store, trying a new route, taking the bus, building something or buying something without doing any research, trying a new restaurant as well. The purpose of exposures is to show you that you can do these things and that anxiety is temporary. It helps build confidence. Another tool in CBT that we use is called behavioral activation. We tend to use this for low mood or depression, but it can be helpful in many different areas of your life. Behavioral activation is a technique used to help individuals increase engagement in positive activities. It includes breaking down overwhelming tasks into smaller, more manageable steps, gradually increasing participation in enjoyable activities, and reducing activities that lower our mood. By taking action, individuals can improve their mood, reduce symptoms of depression and anxiety, and enhance their overall quality of life. Behavioral activation can also help us better identify activities that may be breaking down our mood. For example, watching too much TV or watching the news for too long. We can then use that data to see where we need to make changes in our day and incorporate a better balance of activities, like maybe adding a short walk, a creative activity, crossing something off your to do list, or a nice, relaxing puzzle. In Ontario, we have a combination of OHIP covered free mental health services, which you can see the list below, as well as private therapy, which is typically benefits or you pay out of pocket. There are a variety of different CBT options locally. Reach out to your nurse practitioner, your nurse, your family doctor, or a mental health provider for referral recommendations.